Welcome, folks. We're going to get started in a minute or two. We'll let a few more join.
Okay, I think we're going to get started. Good afternoon, everyone. My name is Santiago Neme. I'm an infectious disease physician, also the medical director at UWMC Northwest. I practice both at UWMC and Harborview, and I see patients with general infectious diseases as well as HIV and LGBTQ health. I'm pleased to be joined today with by Dr. Seth Cohen. Dr. Cohen is an infectious disease physician as well. He's a clinical associate professor in the Division of Allergy and Infectious Diseases, and he's also the medical director of our University of Washington Medical Center Infection Prevention Department. Welcome, Seth.
Thank you. Hi, everyone. Thank you so much for joining us this afternoon. We really appreciate it.
So we thought we would start with a question that comes up often in terms of the main topic that we're going to be discussing today, that addresses what do we know about patients or people who are children in terms of COVID. At least for, in my opinion, there's relatively little on PubMed and the literature in general talking about the disease course in children, how transmissible kids can be, how the severity of this variant versus the other variant, and really the impact of potentially vaccinating more kids than we currently are right now. So Seth, what can you tell us about where we can find more data on this?
Yeah, so these are all really good questions. And I just want to make sure people know that, several of these questions were submitted in advance. So, Santiago and I are going to have a conversation about some of the really great questions that people submitted. But if you didn't submit a question or there's something else that pops into your head, please feel free to type it into the Q&A and then we'll try to talk about it live. Hopefully we'll have plenty of time to do that. The other thing I'll say is, I'm not a pediatrician. I'm an adult infectious disease doctor, but I am a parent and I have two little ones at home. And so I try to follow the pediatric issues pretty closely. Vaccines, especially among kids, are a really hot topic in our household. And I'll just say a few things and, Santiago, please chime in, but, kids of all ages get COVID. And what we've seen so far is that children under the age of 12 seem to be less commonly affected than adults, at least with the variants that we've seen to date. And that's certainly been one of the silver linings for me of this epidemic. So at any time, kids account for somewhere around 15 to 16% of laboratory confirmed cases. But, these are really underestimates because we're not capturing every infection that children get. And I think the person who submitted the question was wondering, how can I get more information about this? So there's a lot of good information about COVID in kids, both on the CDC website and also the American Academy of Pediatrics tracks these numbers really closely. The challenge is, I think, from a public health standpoint and a messaging standpoint is, yes, thankfully, a lot of these infections in children are mild, but they still contribute to these really significant cycles of transmission within families and the community. Even if a particular child is healthy, they could still transmit it to one of their peers who may have underlying risk factors for infection. So there are really a number of downstream consequences to kids getting COVID-19. And I think the other part of the question that is really key is, what is the risk of transmission from children? And we don't have really great estimates of, the risk of transmission from kids. We do know that older children can transmit just as efficiently as adults can in the household and other community settings. And then we also know that viral loads in those little noses are at least as high as, in adults or even higher. And so we're certainly seeing, a number of smaller outbreaks happen in the, public school system locally, and we're really keeping a very close eye on this. I think the other question in my mind that, is an opportunity for, for science to really kind of dig into some of these issues is we don't have a great understanding of what some of the long-term consequences are for COVID in kids. There's certainly a population of children who have persistent symptoms just like adults do. And there's also a population of kids who gets this multi-system inflammatory response, which is really a feared complication of COVID. So lots of reasons to think about vaccinating kids and trying to keep them safe.
Thank you so much for the information.
Yeah.
I'm seeing whether there's any questions. I don't see any. Do you want to pose the next one?
Sure. Yeah. So, and if there's anything else on kids, you're welcome to chime in. I'm sorry for the long-winded answer. It's something I'm really passionate about. Santiago, other people are asking, why is there not more of an effort to get the rest of the world vaccinated? And I know that, you have family living in other countries. I'm curious about, what their experience is like, and the person who's asking the question is saying many other countries have less than 5% of their population vaccinated. Granted, neither of us are fully engaged in the global health effort, but if you have any comments around global, vaccines, we'd really appreciate it.
Yeah, thank you. I think that's an excellent question. And unfortunately, vaccination has not been equitable across the different nations. I happen to be from Argentina, where now there's reportedly 70% of the population has had one dose of vaccine, as opposed to 2 doses. So the second doses are lagging significantly behind. And Argentina is actually ahead of many countries in Latin America, and also, Africa and other places where vaccination has really lagged behind. If we don't really understand that COVID is a pandemic and it's global, and that it goes way beyond the individual person, the individual group, the individual nation, we're going to continue to have a significant challenge in battling this. On the one hand, I could say that different governments have approached things differently. Some governments have invested if they have money. Some governments have kind of played with investing in multiple different vaccines. For instance, right now in Argentina, you can get a dose of Sputnik and you can get a second dose of Moderna or Pfizer or whatever is really available. So whereas the approach in the US has been very evidence focused and evidence-based, where if you get vaccinated with Moderna, you're going to get a second dose of Moderna because we have the supply, we have the research, we have the quality controls. That being said, the one silver lining here is that the current administration, the Biden administration, has been very intentional in donating massive amounts of doses across the nation. Some might say that that's not enough because, again, you would like to see other countries like being able to manufacture some of these amazing vaccines that we're lucky to have in the US, as opposed to transporting doses from here or Europe. But I do think that it's important to see that there's been more than 600 million doses of vaccines that have been donated by the United States to many countries, including Argentina. That's allowed folks to have vaccines that are amazing, like Moderna, like Pfizer, and get those into their arms.
Yeah, I completely agree. I was reflecting on this. I got my booster yesterday and was reflecting on it. I just feel such immense privilege at having access to all of these vaccinations, having 3 shots at this point, where much of the rest of the world does not have access. And some of that is a vaccine capacity issue, but other parts of it are sort of a last mile issue where the issue is not vaccines, but vaccination. And so it's really about scaling up infrastructure that it's very, very complicated. So I do think, there are some silver linings here. I read that, we've given more than 5 billion doses around the world, which is just incredible. But I think as the person asking the question is alluding to, we still have a very long way to go. And unfortunately, we're going to continue to see the entire Greek alphabet of variants until, the majority of the world is vaccinated.
Thank you, Seth. And I did want to put this, unfortunately, we don't have to cross the country borders or frontiers to find inequity in terms of vaccination, like here in King County and here in the Seattle area and in Washington State, we still have populations that are really lagging behind in terms of getting vaccinated. And I think that the easy excuse is that folks just don't want them. But the truth is that that's not the whole story. The whole story is that for some folks, it's been really difficult to get vaccinated because they are either working all the time and they can't take the time to go get vaccinated, maybe because they don't really understand the language in which vaccination information is displayed to them. Maybe they don't have transportation. Maybe they're the primary caregivers of someone who's sick at home. So in doing all these conversations and having all these discussions with folks, I've learned to be more humble in terms of understanding what's going on. And instead of me giving an answer, I tend to start by asking, what is the key issue that has prevented you from getting vaccinated? If it's education, we can fix it right then and we can provide education, but oftentimes it's a lot more complex for some families, especially African Americans and Latino folks who struggle and who tend to do some of the essential work that needs to be physically, done as opposed to something remote, for instance. So it's complex. We're trying to make a dent on it and make sure that folks get the information they need.
So I'm going to just ask you a follow-up question that came in about this. And specifically, what is UW doing to improve access to healthcare equality and equity in the Puget Sound area?
Yeah, so I have to say I'm very proud of UW Medicine in terms of the significant outreach and efforts that we've engaged in from the very beginning. This office, the Office of Healthcare Equity, led by Dr. Paula Houston and Dr. Bessie Young, has done a tremendous amount of work. And I would say it backtracks even before the vaccines were available. It started with really getting testing out in the community as opposed to hoping that patients would come to UW Medicine to get tested. So there was a mobile van effort to really do the outreach, and we set up vans in areas like, for instance, I participated on a testing activity in Lingwood, and I was just amazed at how greater than 80% of the people showing up to get tested only spoke Spanish, and it was amazing to see. So testing, vaccination education. For instance, we've partnered with King County and Department of Health, and we've taken vaccine discussions to actual prisons and jails in our area to make sure that folks have access to education from experts like Dr. Shrisha Dennareddy, like Dr. Bessie Young, like myself, and many others who participated in them. And we've also had mobile vaccination clinics and partnerships also with sports teams like the Mariners to try to get the message out. So there's been a lot of outreach, and we haven't really focused only on what we can do within the walls of UW Medicine, and that pushed our mission really to improve the health of the public, which is the center that we all have when we work at UW Medicine.
And Santiago, I think along those lines, I think there's been a lot of work done around, vaccines and testing, as you mentioned. People may be less familiar with some of the work around monoclonal antibodies, which are, very resource intensive. And, I think initially when they came out, both of us were very concerned that they were primarily going to be administered to people who have, really excellent access to the healthcare system or have providers who can advocate for them. Would you be willing to just briefly say how we're approaching issue of monoclonals from an equity standpoint?
Yeah, absolutely. So we have different sources of information around these monoclonal antibodies that are basically prefabricated antibodies that help the individual who has COVID really boost a better response and therefore prevent complications from COVID. So the way we set up our work around this is we have a clinical team led by Dr. Srisha Danareddy, Rupali Jain from pharmacy, and myself. And we have also some administrative assistant from several people. But basically, we can either get referrals from providers within the system, providers outside the system, and we actually get the test results from anybody tested within UW Medicine. And we're actually now about to get test results from other areas of King County that are Department of Medicine, Department of Lab Medicine at UW School of Medicine is actually doing. So we're going to have even a larger source or input of data. And we basically have a prioritization grid where we assign the different criteria, and we do this in a completely objective way. We also realize that some patients may need transportation or may need other things, might need interpreter services, and we make it work. We actually have a fund that we can use to help with transportation. So we've been able to make things pretty equal and equitable across.
Great. Thank you.
Excellent. So a question for you, Seth. A lot of, I'm not a parent or pediatrician, disclaimer, but a lot of parents seem to be concerned around, their kid might be very allergic. But by very allergic, I mean kids may have significant peanut allergies, nuts, or other things. With the vaccines, these vaccines, and we're talking specifically around Pfizer because it's the only currently approved for kids. But should they be worried about a reaction if they have allergies to things like peanuts or other foods?
These are really good questions, and adults raise the same questions. We have a lot of I'm involved with our employee health efforts to get our entire workforce vaccinated, and so we have a lot of staff with a long history of allergies to flu shots or foods or other things. And actually, we've been safely able to vaccinate, the vast majority of them. And there's really no cross-reactivity with peanuts or other known food allergies or pet allergies or environmental allergies. And there's actually very, very good data from the FDA and the CDC that we feel very comfortable giving vaccines, even if kids have a prior history of anaphylaxis to some other unrelated ingredient.
Excellent. I just wanted to clarify this question. Do you suggest to give vaccines to 5-year-old kids? That's the question.
Yeah, so not yet. So we're, right now, and we can certainly just talk a little bit about what the next few weeks or months might look like in terms of, approving vaccines for kids. So, the Pfizer vaccine was tested in kids ages 5 to 11. This is a 2-dose series. It's 21 days apart, just like the adult series. The difference is the dose given to kids is 10 micrograms. So that's about a third of the adult dose. The adult dose is 30 micrograms. All we really have right now is the press release data. And that tells us that the antibody responses among children who received this lower dose were very similar to older folks who received the higher dose. And the reason they chose this dose was really, safety, tolerability, good immune response. I will say I was feeling a little pessimistic a month or two ago. I did not expect this data to come quite so soon. It would be wonderful if these vaccines were, made available during the respiratory viral season. So what has happened is Pfizer has submitted their data to the FDA. That generally takes a few weeks to review. The main focus of this review is safety. And all of this data is public, the discussions are public. There's a lot of transparency around this process. And so assuming that the FDA moves forward with approval in this age group, then yes, UW would be able and ready to administer vaccines to that age indication 5 to 11. I think all of us are looking forward to reviewing that primary data. It's hard to say much just about the press release, but there's going to be a lot more information coming in the next few weeks.
Thank you. And so far, at least my understanding is that although we always like to see the data, the press releases that we've seen tend to reflect almost identically what the final paper, the final data really looks like. We don't want to act on a press release, but there's been a nice coincidence or consistency within the data so far. So, but we will never act on a press release. Great. And then can I ask you just a follow-up question on that?
Sure.
One question that has come up, and I hear that, I got Moderna, so a booster for me is not available at this time. And a lot of my colleagues like yourself are getting, the flu vaccine and the booster at the same time. One of the parents asked whether one should do the same with kids, kind of wait until the COVID vaccine gets approved for them and then give them the shot, or would you do it now? What would you do?
Yeah, very good question. It comes up, on the employee health side and the patient side all the time. And I would say never waste an opportunity to vaccinate. I would not overthink this. There is not any reason to expect more side effects, when you're giving 2 doses rather than 1 dose. And so we are routinely giving both vaccines at the same time. And honestly, I think kids will probably tolerate it better if you give them both at the same time and then give them a little reward afterwards rather than kind of dragging out 2 separate vaccinations spread over a few weeks.
Excellent. Thank you.
Mm-hmm. Yeah. So let's see, Santiago, I know there are a couple other questions for you. So you're a Moderna person, if I remember correctly. So for folks who got Moderna, are you able to get a Pfizer booster shot?
No. Currently, the folks who got Moderna are supposed to wait for another dose of Moderna. We are not switching vaccines. That being said, if by mistake I got a dose of Pfizer, biologically, I think I'd probably be okay, but it's not a recommendation. And we know that from the primary series, right, there were folks who unfortunately got a different vaccine and they did well and they're protected. But the formal recommendation is that the people who did not get Pfizer wait for the booster. This is different from the people who were vaccinated with 2 doses and because of their immune system, they need a 3rd additional dose. That's different, right? If I were an immunocompromised patient and needed a 3rd additional dose, I would have gotten my 3rd additional dose. The booster is different because I've completed my 2 dose series. So I just wanted to drive that point. So for my booster, I will wait until it's recommended.
Great, thank you. And I see a couple questions in the chat. One person is asking, is it true that more teens and children under 12 have been in the ICUs in the past few months than ever before in the pandemic? If so, is this due to the Delta variant? Is it because Delta is more transmissible, or does Delta somehow impact children differerly? And yes, we have certainly seen huge spikes in pediatric hospitalizations, which is just terrifying as a parent and as a healthcare worker. I think there are probably a number of reasons for this. One is we do think Delta is more severe. And that data comes primarily from adults. I don't know as much about the pediatric Delta specific literature, but we have seen that Delta infections compared to Alpha, for example, have a higher chance of going to the emergency department or becoming hospitalized. So this is really a challenging time for everybody who is unvaccinated. And I also think part of it is, yes, Delta is more transmissible, so we're just seeing higher numbers in general of people becoming sick.
Yeah, and that was reported by our colleagues at Children's too. Like even at our peak initially, right, and in April of 2020, they were seeing 1 to 2 patients, and they were running a census of about 9 this time around, and pretty ill patients. And unlike what they saw in the past, they also reported that in the past, the kids used to have significant comorbidities and ended up in the ICU, et cetera. This time around, what they saw is that there were kids with just asthma, for instance, who ended up getting pretty sick. So again, a bit, more transmissible, more severe. So it makes sense what we're seeing.
And I see a comment from Josh. So thank you, Josh, for just saying this, just saying a shout out to all the folks involved in the inequity resolution efforts, as well as many of our patients at Harborview. It's been heartening to see so many of our compromised patients be successful, not only the first 2 doses, but also the booster. So thank you so much, Josh, for the feedback. We appreciate it.
Yeah, thank you.
Yeah.
Okay. Seth, let me ask you this. Why are we not looking at or acknowledging natural immunity? Why are people who have recovered from COVID being identified as unvaccinated?
Yeah, so that's a very, very good question. Comes up very frequently. And the easy answer is, these vaccines are such a home run that vaccine-induced immunity is actually better in many ways than natural immunity. So vaccine-induced immunity is longer lasting. It's broader, so it probably covers more variants than just the variant-specific immunity that you might develop after infection. And it's just stronger, so it's probably better at fending off reinfections. So we now have pretty good data that shows that reinfections are more common in people who were infected with COVID rather than who received the vaccine. So many reasons, although I would not dispute that people who recover from COVID probably have some degree of immunity. That immunity is quite variable. Some people have a little bit of antibodies, some people have a lot. But we know that there's a lot else going on in your immune system other than antibodies. So we don't just rely on those antibody titers, that your T cells and other things. And we know that vaccines in general are better, and they are really going to be the only way to get out of this. Natural immunity means somebody has had the infection, but they've also had the chance to potentially pass it on to someone else, continue that cycle. And it's great if they don't get hospitalized or have severe illness, but they could still have really long-term consequences from COVID. And I'm sure Santiago has seen this in his patients. In my own patients, I have a number of patients who are really grappling with long-term issues from what started out as a mild COVID infection. So people who still can't smell or taste, people who have brain fog or persistent respiratory issues. I mean, those are things that are not captured in statistics, but yeah, they have some immunity, but I think they would have preferred having vaccine-induced immunity. And we know that vaccines actually reduce the risk of people having long COVID. So lots of benefits to getting the vaccine.
Yeah, just a related question, because you mentioned transmission risk. Early when we first started seeing the breakthrough infections, there was a headline saying that if you're vaccinated and get infected, you are just as likely to transmit the virus than if you're unvaccinated and get COVID. So basically, an unvaccinated and a vaccinated person who get COVID, they have equal risk of transmitting the disease. Is that so today?
Yeah, so that's a good question. I think really an unfortunate example of some scientific miscommunication, perhaps in the media. And I think some of those studies were just not well communicated. So the simple answer is no, that's not true. People who are vaccinated have are much less likely to transmit COVID for a number of reasons. One, they're just less likely to catch it in the first place. Two, their viral loads go down much faster than people who are unvaccinated. And three, because you're constantly making antibodies and other things, you're just less likely to transmit those infectious particles to others. So the studies that were done relied on, sort of an indirect estimate of how much viral genetic material people have in their nose. And that's just not a perfect proxy for transmission. And I think that's part of what got lost in translation.
Excellent. So for folks listening, it's not the same. So if you get infected while vaccinated is much better than not being vaccinated for many reasons, but mainly because you have a less likelihood of being hospitalized and less likelihood of being of dying from COVID. And when I say less, according to King County, just based on the hospitalization data that we have per vaccination status, we know that folks are 42. So unvaccinated people are 42 times more likely to get hospitalized and are 57 times more likely to die from COVID.
Yeah.
So very, very striking.
That dashboard is, I think, incredible. I use that with my patients all the time. You know, this is so for any of you who have not seen it yet, this is a Seattle, King County Public Health dashboard that looks at if you're vaccinated or unvaccinated, matches you based on age. So it compares people with the same age. And it says, what are the outcomes? And the statistics are just eye-popping. So it's very different from those randomized controlled trials where you feel like some of those percentages are a little bit, sterile or, under ideal conditions. This is real world data that is showing that people who are vaccinated are 40 to 50 times less likely to die or get hospitalized. It's really, really compelling data. I see one question that I can tackle very quickly, just a question about, can I speak to people's concerns about mercury in vaccines for kids? So right now, I think that question is probably about thimerosal, which is a component it's a mercury derivative that used to be in vaccines. Since 2001, it's no longer in vaccines. It was used as a preservative. It was present in very, very small amounts. And unlike the regular mercury that we think about, it actually just gets broken down into two little metabolites or little components and then gets eliminated from your body. So it doesn't build up in your body. So it's not a concern currently because it's not in vaccines and it did not have any known health issues associated with it previously. Santiago, are there any known reaction to booster doses like there were with second doses?
I actually don't know that we have enough data on the boosters, but what I can say is that so far it just doesn't seem to be the case. You clearly heard from, and just looking at the data of VAERS and all that after the second dose, there were some people like me who felt kind of ill for a few hours. Mine lasted about 22 hours and then felt totally fine. I would say that we still don't know because the boosters have just started. Now, the third additional doses are different again, but the boosters have just started. So I don't know, Seth, if you have any preliminary data on this, but I'm not aware of issues. But.
Yeah, the preliminary data that I've seen looks like the profile is pretty similar to your second dose. And so at least, I'm one anecdote. I'm not the same as data, but my experience has been, it's been very similar to the second dose. And that's really, we've already vaccinated, many healthcare workers and people are doing just fine. So we've not seen any, worse side effects than we did, the first or second time around.
Right. And I think it's going to be interesting to see also with Moderna, because traditionally the reported symptoms after the second dose were slightly higher for the Moderna group like myself. So I think it's going to be interesting to see. For the third additional doses, I'm not aware of any differences between all three doses. And we vaccinated a lot more people with the third additional doses. I don't know, Seth, if you want to share anything on that.
Nope, I don't have much to add.
There is a question here about what vaccine impact may have, what impact may vaccines have on young kids who have kidney or heart defects?
Yeah, so really good question. And I think that's a perfect question to look to the FDA and the CDC to make recommendations about that. When I hear about people who have underlying health conditions, I typically think of that as an extra reason to get vaccinated rather than a reason to be hesitant about it. I mean, we know very clearly that people, especially kids with chronic conditions, have a much, much higher likelihood of developing complications or ending up in the hospital. And all of that is generally preventable with the vaccine. So if that were my child, I would say that's an extra reason to get vaccinated.
Yeah, 100% in agreement. And we also see that those complications that are seen in normal young adults are much less common than the likelihood of getting COVID and having an actual complication. So myocarditis is a lot more common with COVID than in the vaccinated. So again, these are things that that we need to take into account, and I think we still learn. But fortunately, we've had like 10 months of these vaccines already, and kids over 12 and over, and we're seeing that the benefit of vaccination is significantly greater. Excellent. So
I see one question in the chat, and this is not at all to get in the weeds, but just a follow-up question about the recent finding by Israel Scientific Data about natural immunity. And I would just say, not to turn this into a journal club, but there, a lot of the Israeli data is at times an outlier, and I would take it in the context of looking at all the other countries that are reporting data through their national healthcare systems, the UK, Canada. There are a number of countries in the Middle East that are reporting data. And also the Israeli data uses somewhat different definitions for severe infection. So there are a number of reasons why that data may look a little bit different. But I would just say take it in the broader context rather than finding one study that seems to suggest that there may be a benefit to natural immunity.
yeah, and just for full transparency, a prior infection does give you protection, but we've seen a significant number of reinfections. We've also seen that you could have had COVID when Alpha was around, but now Delta is a different ball game. So again, let's not rely on the protection that you get from an infection and then go and get infected. That's not worth. This is not how we do things. You want to get the vaccine, so then you're protected. If you happen to be infected, you're going to be much less likely to die from it, be in the hospital, etc., and then transmit it to others as well. Great. So let's see.
There was one question I saw about just thinking about risks and benefits when thinking about myocarditis and hospitalization, particularly among young boys. And that's something that I think is a real important question for people who are just weighing, what's the risk and what's the benefit. And I think, yes, we were surprised, we were surprised that there was a risk of myocarditis with these vaccines. The risk is extremely, extremely rare. But, how do you balance that with, when kids in general tend to have more mild infections? And I think what helps me think about it is actually people with COVID, and this is not well publicized, but the CDC put out a nice study about this. People with COVID actually have a 16-fold higher risk of myocarditis than people without COVID. So actually, COVID is a bigger risk factor for myocarditis than the vaccines are. And I think that really dwarfs any concerns I would have about the vaccine. That there's also issues with just like how we estimate the risk with the vaccine. It's data that's sort of self-submitted to the CDC. It doesn't mean those submissions are necessarily tightly linked to the vaccine. It just means they happen to have happened within a few months of receiving the vaccine. And so just thinking about all the other benefits of getting kids vaccinated, keeping kids out of the hospital, keeping kids from spreading it to their teachers, to household members, to vulnerable peers, and then keeping them from developing long-term consequences of COVID. Those are risks that I just would not want to take for my own children.
Right, but let's say also, Seth, what happened to these teenagers who got myocarditis? So what do we know? For my reading, most of these cases were reversible.
Yep.
The kids did well after that. And we also know that myocarditis is typically more prevalent in that age group as well. And it tends to be reversible. So I think I'm not trying to minimize things, but it's not it doesn't lead to that prolonged, heart failure or issues that you can get in adults.
Yep, I completely agree.
Excellent. There's another question related, Seth. Isn't myocarditis also an immune response when the body is fighting an infection too? So is it in some way the body's immune response being activated by the vaccine in a good way?
Yeah, I think when you get it from, not get it from the vaccine, but when you have an immune response related to the vaccine, yes, that's probably what's driving the myocarditis, is what we think happens, because the vaccines don't have any infectious particles and they don't cause infection. So there probably is a really exuberant immune response that is occurring and tends to resolve pretty quickly.
Excellent.
Santiago, maybe I could ask you just a policy question that people have, because we're coming up on the deadline for the governor's mandate and for all healthcare workers to be vaccinated. So, with your medical director's hat on, is there a concern that staffing is going to be impacted by the vaccine mandate?
Yeah, there's been, we've always been concerned about this, but we also think that maintaining a safe environment for our staff and our patients is the top priority, and it's been so from the very beginning. We're lucky in that our staff and providers have had outstanding vaccination rates. We are losing some people, and it's concerning, but we're also implementing a mandate that the government initiated. And we also believe that it's important to get everyone vaccinated. Actually, patients are asking whether we're vaccinated. How are we vaccinated? Like how much? How many people? So I think it's unfortunately we will lose some people, but we really needed to focus on the safety of our patients and our colleagues. The same way, imagine now a lot of the restaurants are asking for a vaccine certificate or passport, whatever we want to call for your vaccination card. Well, if a restaurant is doing this, why not a hospital? Like, why not having a safe environment when we're caring for patients and when patients need us to be at our best and really prevent even more of an impact on our workforce, because we know that the more COVID there is, the sicker we would get, and therefore it would impair our ability to continue to care for our patients and population.
Well, I think that's a really nice note to end on. I don't know, is there one more question that you wanted to get to, Santiago, before we close?
No, I just wanted to encourage everyone to keep talking about vaccines, to keep asking questions, to engage folks. You don't have to be an infectious disease specialist to talk about vaccination, why it matters to you. I think oftentimes a lot of people that we talk to are looking for a familiar link, a shared experience. And that part is something that maybe Seth or I cannot do with our patients. But they want to hear about your cousin who got really sick, or someone who died, or someone who was an A before and now a yay, or someone who was pregnant and almost lost her baby because of COVID. I mean, we're seeing a tremendous amount of disease associated with pregnancy in women who are not vaccinated. And we have tons of data. So the best way, I know we're all anxious to protect our children, especially between ages 0 to 12. We don't have a vaccine for them, but the best way we can help them is by creating a safer environment, by all of us really getting vaccinated.
Yeah, well said. Thank you all for joining us. We hope you stay safe. We hope your children and loved ones stay safe, and look forward to seeing you in future conversations.
Thank you.
Thank you all.